My name is Gabriela Bezakova. I come from Slovakia. I work as a psychiatrist at University Hospital in Bratislava and also as assistant lecturer at Comenius University. So this work was created in collaboration with my colleague Adam Greif, who is a philosopher and who also works at Comenius University. So our work focuses on psychedelic spirituality in general, and in my part of the presentation, I will focus on it from the context of the therapeutic setting, and Adam, after my presentation, will focus on it rather from the perspective of scientific research. So psychedelics are well known to occasion spiritual and mystical experiences that are often profound, transformative, or even life-changing. And these are often accompanied by spiritual and metaphysical insights, although not all of the psychedelic experiences, but many of them. It is also now known that some of these experiences can lead to reshaping of the beliefs, and it can lead sometimes to even this supernatural direction. So I believe that this lies at the controversy of spiritual dimension of psychedelics. So some view this adoption of supernatural beliefs as a form of harm, while others see this focus on spiritual and mystical experiences as something essentially unscientific. So this raises the question whether psychedelic spirituality is compatible with the scientific worldview and with secular therapy models. So before we dive into this topic deeper, let's look at the typology of spiritual experience and psychedelics. So this typology is based on factor analysis by Yaden and Newberg. And they group spiritual experiences into three broad categories: numinous experience, mystical experience, and paranormal experience. Each of these categories have also their own subtype. Although mystical experiences are probably the most studied, psychedelics that do not cause only mystical experiences, but other type of spiritual experiences as well. So you can see that for each of the subtype, we can find some corresponding example from psychedelic research. And you can also see that it can extend into these paranormal dimensions as well. So to give you a better idea of what this kind of experience can look like, this is an excerpt from Davis's survey of entity encounter induced by DMT experience. So I was essentially told that I was God. It telepathically gave me information that said this being was in service of God. So on one hand, I can see how this is exciting from the point of view of research, but I can also see how this can contribute to skepticism, especially in those who are concerned about adoption of supernatural beliefs. So we know that psychedelics can sometimes alter metaphysical beliefs towards range of non-physicalist views such as dualism, panpsychism, idealism, non-naturalism. Also, one study by Nayak and Griffiths showed that single belief-changing psychedelic experience is associated with increased attribution of consciousness to inanimate objects. So this somewhat supports the concern over epistemic impact of psychedelics and the rise in supernatural beliefs. So this brings me to comforting delusion argument. So this argument was developed by Christopher Leatherby, And he operates from the standpoint of philosophical naturalism. This philosophical naturalism is notoriously difficult to define, but at the base, the view is the natural world is all that exists, and supernatural forces and entities do not. From this perspective, any supernatural belief that may arise during or after psychedelic experience is by definition false. So according to letter B, psychedelic therapy may be deemed ethically questionable by achieving therapeutic outcomes by inducing or reinforcing supernatural beliefs. These supposedly false supernatural beliefs. So by this, the therapy causes a form of harm. So this harm is, of course, not physical or psychological, but it is a form of so-called epistemic harm or knowledge-related harm. So it undermines the patient's ability to hold justifiable views based on reality, basically. So the real challenge for letter B is whether it is ethically acceptable for psychedelic therapy to achieve positive outcomes at the cost of epistemic integrity of the patient. Against the comforting delusion argument, we emphasize the autonomy of the patient's thought and freedom to interpret their experiences in their own way. So this autonomy means that we should let the patient to freely think for themselves, to freely explore new ideas and new beliefs without manipulation and without coercion. We also emphasize that, therefore, we should focus on the therapeutic outcomes of the therapy, not on the content of the belief. So the belief content shouldn't matter ethically, only its outcomes. We are also drawing on William James's pragmatic principle, which holds that the value of the belief is not in whether it is metaphysically true, but in what it holds for the patient that has this belief. If a belief, even supernatural one, improves well-being, reduces suffering, and fosters personal growth, then we believe it is ethically acceptable. So the main argument is to focus on the therapeutic outcomes and not on the content of the belief. Also, we should keep in mind the major classification systems such as DSM-5 and ICD-11, which characterized mental disorder by causing clinically significant distress and impairment. So if it's just a belief and there are no other symptoms or things that should be at the attention of the clinician, then we shouldn't really regard it as problematic. Major psychiatric associations already issued ethical guidelines on spirituality and religion in therapy. Despite being developed for general clinical conditions, I hardly see why this would not be equally applicable to psychedelic therapy. Also, if we accept psychedelic exceptionalism, then this issue to follow clear ethical guidelines is even more pressing. Of course, there are differences between these ethical guidelines, but they share common principles, and I try to condense them into these several points. So, as I said previously, we need to respect autonomy of thought of the patient. We should avoid imposing our own beliefs onto the patient. When these spiritual or religious struggles arise during the therapy, we should engage with them with respect and empathy. Of course, we have to prioritize well-being and therapeutic outcomes, deal with the spiritual issues with cultural and spiritual sensitivity, and refer to the spiritual care expert when needed. So I think we need to be aware of our own competencies and just the boundaries of our own knowledge. So all of these ethical codes emphasize the outcomes of the therapy, not truth of beliefs. So one of the current real-world example of ethical issue is placement of religious symbols in therapy rooms. So we know that religious symbols have the power to shape the experience and its following interpretation. This is important, or this is happening also in this like heightened state of suggestibility the psychedelics can induce. Therefore, we believe the presence of these kind of symbols, they should reflect the patient's preferences and beliefs and not the preferences of the therapist. We recognize the value of ritual elements, but these do not necessarily need to be religious. Elements such as lighting, playing evocative music, artwork, or serving the substance in the chalice can serve more or less similar function. Besides, there are already countless secular rituals throughout society, from funerals to graduation ceremonies. So I believe they also signify the importance and some kind of transition for the people who undertake this ritual. So we should consider using this type of naturalistic, non-religious ritual elements. Carefully designed ritual elements can also help underscore the gravity of the situation and gravity of the decision to undergo psychedelic therapy. And it can serve as a form of enhanced informed consent. Ultimately, placement of any kind of symbol and using of any kind of ritual element should be discussed with the patient prior to the therapy, and it should be followed by clear and transparent informed consent. This brings me to my conclusion. So hopefully I demonstrated that psychedelic spirituality can be ethically integrated into therapy in a way that respects their autonomy and promotes their well-being. These are my references. Thank you.
Thank you, Gabriela. We have lots of time for questions and comments. There we have one.
Thanks for your talk. I think I agree with the guidelines that you've laid out. But I was wondering, you were saying if there's no measurable distress following a supernatural belief, then this is no problem. But this is something that you don't know beforehand, right? So it could be that even though if we apply all these guidelines, a patient could have a supernatural experience that then develops into a belief that causes distress in their normal life, either because it's dissociating them from their previous beliefs or from their peers or whatever. So how do we deal with that?
Yeah, that's a good question. So, I mean, we always talk about the preparation, before the psychedelic therapy, but we also know that it is very difficult to prepare for. So we don't know what might happen, but I think the part of the preparation should be priming the patient for this possible, like, transformative experience, which can include change of the beliefs. So I think that's the best we can do. And also, as I said, I believe in the enhanced informed consent. So we should put these like safeguards in place and prepare the patient for what might or might not come. So, but if some kind of distress or even impairment arise, of course, that should be at the center of clinical attention following the experience.
Thanks for the presentation. I think they are really good ideas you shared. Just to defend Chris a little bit, I think his argument, or I think he quite explicitly says that the epistemic harm exists only, or in the case that we take metaphysical naturalism as a starting point, or with the premise that our common, which is quite common in science, that you have the assumption of metaphysical naturalism, that if that is true, in that case, there is the epistemic harm from the supernatural beliefs. But I think he is not saying that it's absolutely, and he doesn't say that we are totally sure that the metaphysical naturalism actually is true.
Yeah, I mean, after all, it's a matter of philosophical discussion. Yeah, and that falls outside the scope of psychiatry, I believe.
Thank you. I was wondering about potential tension with autonomy to freely interpret the experience from the patient side, and then also the recognition that some interpretations are more adaptive to the person than other ones. So that sort of contention, my supervisor, Hanna Meretoja, is from doing this narrative hermeneutics assessment model for different interpretations, and one criteria is that some interpretations open person up to new possibilities, and some close them to dogmatic worldview and kind of limit their potential to perceive new opportunities or possibilities. So maybe talk a little bit about that tension between better and worse interpretation and still kind of retaining the freedom.
Mm-hmm. Mm-hmm. Yeah, so I think in medicine we move away from this paternalistic approach. Okay, so we give to the patient as much freedom as possible, but of course it comes with costs. Yeah, so sometimes they really can adopt some beliefs that are maladaptive, but I think it's up to the skillful therapist to recognize it and work with it and integrate the belief in a way that is that promotes their well-being, as I said previously. So I hope that answers your question.
Thank you for your presentation. Well, I think that living in a religion is also about other things than worldview or experience. It's also lifestyle and ethical issues and something like that. So instead of asking if spirituality is compatible with psychiatry, I'll ask if, for instance, psychedelic therapy or uses of psychedelics is compatible with religious ethics. Can use of psychedelics be a sin in some context? And are there, for instance, some cases where you need to consult the spiritual specialist?
Mm-hmm. Okay, so I believe that when it comes to psychiatry and just psychology and working with the patient, this religious and spiritual dimension is often overlooked. So also in my education, I was never thought that I should ask my patient about their spiritual and religious views and whether they can maybe contribute to their well-being or otherwise. So we need to keep this holistic view of the patient and include inquiring about spirituality and religion prior to doing this therapy. And if some issues arise, then I think it is ethical to consult a spiritual care expert if needed. And of course, if the patient desires this kind of talk.
Thank you for fascinating presentation and thoughts. And twofold question. Have you found or encountered some good pragmatic guidebooks or design principles for therapy clinics on how they could and should design their therapy rooms? And then more specifically, what is your approach, or have you found something about using abstract art and sacred geometry mandalas, which you had in the presentation, or things which really induce our mind deeply?
Mm-hmm. So I haven't found any guidebook on how the therapy room should like, but this is a very good point that maybe by doing all these guidelines on how to do psychedelic therapy, maybe this should be in the playbook as well. But I don't think I've come across anything like that. So, but what I've come across is that, like, in order to keep it secular and compatible with this like mainstream medicine, then the environment should be neutral, and any like symbols and imagery should be based on the patient's preferences. So to give you example from my clinical practice, because I work with ketamine, and before I prepare the patients for the sessions, I ask them to find some music that they like. I don't want to play the music that I like, and then maybe there will be some kind of tension, they won't like it, and it will influence the session. So it is best idea for them to find the music that they like, they will enjoy during the session. Okay, so yes, we should have some kind of a guideline, but we should also keep in mind the preferences. Yeah.
Let's take 2 final questions before turning to Adam. We can continue discussion after his presentation.
Thank you very much. That was really interesting. Sorry, my voice. I just the way when you start. First of all, I want to say I agree pretty much with everything that you said. But at the start, when you presented these surveys that show people have changes in metaphysical beliefs, people believe in the supernatural. How nuanced are those definitions that are presented to people who fill in the survey? Because the word supernatural could mean one thing to one person and another to another. To one person, it could mean fundamentally unable to be verified by physical science. To another, it could mean just very unusual. And then, this idea that it might conflict with scientific worldviews. How many scientists have the same scientific worldview? Mm-hmm. And how nuanced is the description of what is the philosophy of science? So there's a danger in these kinds of surveys that basically questions are quite vague. People interpret it in very different ways, and then the researchers impose their own interpretation on that. So is there anything you could say about that? Thanks.
Yeah, so this is a really, really good point that I don't know how these surveys were conducted, to be completely honest. So yes, with these spiritual experiences, it can really come down to the definition of the person themselves, like what they understand by paranormal or numinous. It's true that when you come across an entity during, let's say, DMT experience, you can hold this like psychological perspective that, the entity is just part of yourself. It's not something supernatural and outside of your psyche. So, yeah, this is really a good point. Mm.
Thank you for your talk. I was wondering, what is your take on Jungian psychology? Because, it's maybe very related to symbolism and some universal archetypes, and it has some sort of religious relation, not maybe super directly, but just wonder how to implement that maybe into psychedelic therapy.
Okay, so I think Jungian psychology is not something that is mainstream in psychology. It used to be, but not anymore. So like now, I think like the mainstream view is that Jungian psychology is something that leans really towards this like spiritual or even esoteric side. So I do not really have the answer on how to integrate it or whether we should even integrate it. Yeah. I personally find it fascinating, but I try to practice medicine that is in line with like the recommendations and guidelines. So we should always follow that.
Okay, let's thank Kabika once more. Thank you.